Dr. Marilyn Stebbins is one of these patients that have been having positive and negative results. Marilyn, could you summarize what's going on?
Sure. So my first positive result was when I was hospitalized on March 3rd. Then just before discharge, the day before discharge on March 9th, I was tested again and was positive. On April 16th, I was tested and April 2nd was tested again and was positive a month after my first test. And then on April 16th, I tested negative and was going to do my confirmatory test on April 20th, and it came back positive. Then again, a week later, tested on the 27th, negative. Then tested 2 days later, hoping to get my second negative on the 29th, came back positive. And then again, started the process of 2 tests, trying to get 2 negatives. And on May 4th, tested negative, tested again on May 6th, and voila, I made it, negative again. So finally got my second negative on May 6th. So I've tackled that battle, and now I'm on to a new battle, and that's one of advocacy. And when I look at Governor Newsom's 6 points to reopening, and one being a task force or a force of testers as well as contact tracers, I look and say the Health and Human Services in the federal government allows pharmacists to do that testing. And instead of hiring a new workforce in California to do this testing, and most of it being surveillance testing, why aren't we allowing pharmacists in California to do it, much like Governor Cuomo signed an executive order in New York to allow pharmacists? We now have many states that are allowing their pharmacies and pharmacists to do the testing. And this is particularly important in our rural communities that really want to get back to work and stop shelter in place. But without this surveillance, it's going to be very difficult to do it. And there is a pharmacy in almost every community in the country, rural or not. The statistic is there's a pharmacy 5 miles within a 5-mile radius of any community. So we have pharmacists giving vaccines. We have pharmacists doing other testing. So I am now working along with our California Pharmacy Associations and pharmacists to get our governor, Governor Newsom, to sign an executive order to allow pharmacists to test.